Hello, everyone. We are on day 86 out of the 90-day free NCLEX review series, and we are also inviting you to enroll to our NCLEX-RN review at stanco's-nclexcoaching.com. And today we'll continue tackling Q&As on fractures and its management. So let's get started with our first question. First question states, an unlicensed assistive personal reports that a client with a fractured femur has fatty globules floating in their urine. What should the nurse do first? A. Obtain an arterial blood gas and request a portable chest x-ray. B. Instruct the UAP to maintain strict bed rest for the client. C. Call healthcare provider to request a ventilation perfusion scan, possibly has this complication. Letter D. You gotta assess the client for breathing difficulties or mental confusion, because these are signs of fat embolism, which is a potential complication when fatty globules appear in their urine. Now, if you selected letter A, obtain an ABG sample and request portable chest x-rays. These are important, but before we can do those, we need to assess our patient first for the we are seeing in letter D. Now, if you selected letter B, bed rest is necessary, but the nurse must first assess the client for instability. Now, if you selected letter C, call the healthcare provider to request ventilation perfusion scan, or this is what calls a VQ scan. This is useful in the diagnosis, but it's not the top priority initially. You've got to make sure that you have your baseline assessments before we'll take into the next steps. Now let's have our question number 2. A client arrives at the ED with an arm injury. What should the nurse do first? A. Call radiology to request an urgent x-ray of the arm. B. Prepare the client for casting of the injured limb. And C. Remove any clothing from the injured arm. And letter D. Check the nail beds to assess capillary refill time. You gotta have to pick first your initial action, supposedly. The correct answer here is to do letter D. Check the cap refill, because if there is such delay, maybe greater than 3 seconds, it will signal that there is poor circulation to the injured limb, especially the distal part. Okay, we have an issue here, possibly. So this is something that you need to rule out first. You gotta identify if the circulation is compromised to the distal body part. If you selected letter A, call radiology to request an urgent x-ray of the arm. Letter A, call radiology to request an urgent x-ray of the arm. This is an important step, but your assessment as the RN, you need to do the circulation check first. Now, if you selected letter B, prepare the client for casting of the injured limb. This is something that can happen after your assessment has been completed. But this casting can also depend on the severity of the injury, and also it depends on the x-ray results. So it doesn't always happen. Okay. Now, if you selected letter C, remove any clothing from the injured arm, this can help with the assessment, but it isn't the initial priority. You gotta look into the circulation status of that distal part. Wonderful. Looks like you are crushing this 2 questions. I hope. Okay, let's move on to our next question number 3. A nurse is caring for a client with a fractured tibia and fibula. Which symptom requires immediate? A. Weakness and increased tenderness in the leg. B. Increasing pain and inability to locate a dorsalis pedis pulse with a Doppler. And C. Swelling and bruising of the leg several hours after the injury. And D. Pain relieved by a dose of hydromorphone, strong painkiller. So you got to look for that option that requires immediate reporting to the healthcare provider. So which of these options? You should be selecting letter B this time. Increasing pain and inability to locate a dorsalis pedis pulse with a Doppler. This is a distal pulse. It simply means that if there is if you're not able to locate that distal pulse, it simply means that there is now an impairment in the vascular supply. Okay, blood flow is impaired. This is an emergency. And also it can impair the function, the movement, circulation, sensation. If you selected letter A, weakness and increased tenderness in the leg, these are common symptoms. And if you selected letter C, worse after the injury, these are also expected. And if you select letter D, pain relieved by a dose of hydromorphone, pain relief positive outcome. There's no need for you to report this to the medical provider. So your focus here is to identify those abnormal findings that indicate complication. You gotta look for the pulsation. If there is an absence, that's a red flag. If there is a lack of sensation, lack of movement, those are another red flags. So please recall those. You gotta pay attention into the CSM, the circulation, sensation, and movement. Let's have number 4. The nurse is developing a care plan for a client with a closed fracture of the arm. What is the primary problem the nurse should address? A, risk of developing compartment syndrome due to swelling of the injured tissue. B, risk for ineffective coping due to difficulty performing daily tasks. And C, risk of infection due to exposure of bone and tissue. And D, risk for complications related to impaired circulation in the arm. You got a case here of a closed fracture of the arm. So what would be that problem that you is letter D, monitoring for neurovascular complication. It is a closed fracture, okay? It typically can heal without any infection or other issue. So the correct answer for question number 4 is letter D, risk for complications related to impaired circulation in the arm. Let's have number 5. A client arrives at the emergency room with an arm injury. What is the first action the nurse should take? Is it A, remove the client's clothing from the injured arm? Assess the nail beds for cap refill? C, call radiology for an immediate x-ray of the arm? And prepare to prepare the client for casting of the injured arm. I think we have this same question. The correct answer for this is letter B. Again, you got to assess the nail beds for cap refill. You got to check for any compromise of the circulation. Now let's have our item number 6. Let me just take a peek if everything is working. Okay. Let me know. Just let me know if you're having trouble with the live stream. Number 6. A patient with a fractured hip is in box traction and complains of intense pain. What action should the nurse take first? A, elevate the head of the bed to 45 degrees and the foot to 15 degrees. B, check to ensure that the box traction weights are not resting on the floor and hanging freely. And C, change the dose on the PCA machine to a lower setting. In D, position the client on the injured side using pillows for support. Your patient is in box traction. The correct answer here, it is letter B. You gotta check to ensure that the traction weights are not resting on the floor and hanging freely. This is the primary purpose of the box traction. Okay. We want to make sure that the weights are hanging freely in order to reduce the muscle spasms and also the pain. Okay, please take note about the box traction. Now, what is required of in the box traction? You have to recall that this will involve the use of a boot device. This is to secure the traction. And then you should also make sure that the weights are connected to a pulley system right here and should be left to hang freely over the side of the bed. And with regards to the weight, it should not exceed 8 to 10 pounds. That's equivalent to 3.5 to 4.5 kilograms. And there's also somewhat kind of elevation of the foot part of the bed to maintain the traction. Okay, so box traction is a type of a skin traction. This is only to temporarily reduce the pain and also to relieve muscle spasm. Now, if you selected letter A, elevate the head of the bed 45 degrees and the foot to 15 degrees, this is actually going to interfere with the traction system, and this can worsen the condition. So elevating the head of the bed 45 degrees, that is a lot of elevation there. If you selected letter C, change the dose on the PCA machine to a lower setting, the nurse cannot adjust the dosage of the PCA machine without the medical provider's order to change it. Okay. If you selected letter D, position the client on the injured side using pillows for support. So if you're going to allow this, if you're going to turn the patient into the injured side, this will cause more pain and it will lead to more injury. So what you need to do here in this test question is to always assess for the proper function of the equipment first before you are going to adjust any of the interventions that are for any interventions or select any of these other options. Okay, again, you have to assess first the functionality of the traction itself and the related equipment. Let's have number 7. A patient with a left femoral neck fracture has box traction applied. How should the nurse assess for pressure ulcers and give skin care? Is A, gently turn the patient onto each side using another nurse for help. B, loosen the traction and roll the patient onto the non-affected side. C, ask the patient to lift their buttocks using a trapeze. D, place a pillow between the patient's legs and turn gently to each side. We're talking about a box traction here with a left femoral neck fracture. So your task here is to assess for the pressure ulcers and to provide skin care. Now, what would be your intervention to do this? What would be that safe action? The correct answer here, it is letter C. You're going to ask the patient to lift their buttocks using a trapeze. This will allow the patient to lift their buttocks off the bed temporarily without disrupting the traction and to prevent additional pain. So you're going to be able to assess the integrity of their skin. You can also provide skin care this time. If you're doing letter A, turning the patient could move the fracture bone fragments. It can lead to more pain. And if you are doing letter B, loosening the traction, it will interrupt the treatment and it can increase the risk of muscle spasms. And if you're going to place a pillow between the patient's leg, this doesn't really avoid the risk of disturbing the fracture. This can allow support of leg alignment, but it doesn't avoid the risk of disturbing the fracture. So no pillows between the patient's leg and turning gently to each side. Number 8, a patient is being discharged with an external fixation device for a leg fracture. What should the nurse teach? A, you will need to clean the pin insertion sites every day. B, you must remain on bed rest until the bone heals. C, antibiotics will be necessary until the device is removed. And D, you can remove the device when you take a shower. look about the scenario here. It involves the external fixation device, and we're actually discharging this patient. The answer here, it is letter A. There is a need for this patient to clean the pin sites daily in order to prevent the infection around the sites or the points. And the external fixators do not really require the patient to stay on bed rest. Now, if you selected letter B, again, the external fixator device can allow the patient to be mobile. So prolonged bed rest is not needed. And if you selected letter C, antibiotics will be necessary until the device is removed. It's not supposed to be given long-term unless there is an infection present, right? So that is also incorrect. If you selected letter D, you can remove the device when you take a shower. It cannot be removed by the patient. It stays in place until the bone heals. So your task here to identify in selecting the correct answer for this question, you have to prioritize on the infection control, which is basically doing letter A. Because the device is actually penetrating the skin, so you need to prevent this possible infection from happening. All right, let's have our next question, number 9. A patient with a left humerus fracture is immobilized in a cast and sling. What care should the nurse include in the plan? A. Use a dressing to suspend the arm from an IV pole. B. Immobilize the fingers on the affected arm. C. Check the axilla for skin irritation and apply absorbent dressing as needed. And D. Perform passive range of motion exercises on the right arm. The problem here is on the left humerus fracture. And there is a cast and also a sling to immobilize that extremity. So what would be included in the care plan? What you should do here is to select letter C. This is to check the axilla for any skin irritation and to apply absorbent dressing as needed. Okay? This is to prevent the skin breakdown. We don't want any more complications other than the, yeah, you have to prevent this from occurring. Now, if you selected letter A, use a dressing to suspend the arm from an IV pole. It's not appropriate and it doesn't support healing. Now, if you selected letter B, immobilize the fingers on the affected arm. The movement of the fingers should be encouraged to prevent stiffness and also to prevent swelling. Now, if you selected letter D, perform passive range of motion exercises on the right arm. This is for the uninjured arm, and it's not necessary. The patient should perform active range of motion. Now, your strategy here for this test question is to consider the risk of the skin breakdown when there is an immobilization device is applied. Okay, that's the complication that you should take note of. Let's have number 10. After 3 days in the hospital for a femur fracture, a patient suddenly feels short of breath and anxious, saying, "I feel like I'm going to die." What should the nurse do first? A. Check the patient's legs for signs of swelling or tenderness. B. Administer the prescribed oxygen at 4 liters per minute. And C. Reassure the patient that everything will be fine. And D. Inform the healthcare provider about the patient's symptoms. Your patient stated this: "I feel like I'm going to die." What is your initial nursing action here? Take note that the patient has a long bone fracture of course, the femur. And it states here, feels sudden, has a sudden shortness of breath. Your action here should be to do letter B. Administer the prescribed oxygen at 4 liters per minute. This signals that the patient is having a pulmonary embolism. It is a medical emergency. So your action here should be to provide a supplemental oxygen to address the shortness of breath, to provide adequate oxygen. If you selected letter A, checking the legs for signs of swelling and tenderness, this is also important, but this is not the priority in this case. This can happen after you've addressed the problem, which is basically the breathing of your patient. Okay? Do not neglect the ABCs, especially in this scenario. If you selected letter C, reassure the patient that everything will be fine. We know that reassurance is necessary, but you gotta take note about the patient's oxygenation. This is something that needs to be addressed. And letter D, inform the healthcare provider about the patient's symptoms. Notifying the doctor is very important, but this is something that you can do as soon as you've addressed the oxygenation issue. All right, you got to deal first with the physiological needs, such as the breathing. Number 11, just take a peek. All righty, let's have question 11. A client has their leg in traction. Which action performed by the client shows an understanding of how to prevent muscle wasting? A, the client moves the injured leg toward the midline every 2 hours. B, the client rotates the leg outward from the body center twice daily. C, the client does isometric exercises with the affected leg 3 times per day. And D, the client requests the nurse to add a 5-pound or 2.3 kilogram weight to the traction for 30 minutes a day. Your patient is in traction, and which of these options reflects that there is understanding in how to prevent muscle wasting? You should select the option which is letter C. The client does isometric exercises with the affected leg 3 times per day. If you selected letter A, the client moves the injured leg toward the midline every 2 hours. What do you think about that one? This can affect the traction alignment, so do not select letter A. Inwards, not a good sign. If you selected letter B, rotating the leg outward can also disrupt the pull of the traction. Big no. If you selected letter D, the client requests the nurse to add a 5-pound, 2.3 kilogram weight. This is not recommended unless it is prescribed by the healthcare provider. Now, what are the things that the patient can possibly do as part of the isometric exercise to prevent the muscle wasting? One of those will be to do quadriceps setting, tightening the thigh muscles by pushing back the back of the knee down into the bed. And also the gluteal tightening could be ankle pumps and also hamstring setting. Let's have number 12. Which client statement indicates a knowledge deficit about cast gear? A, I'll elevate the cast above my heart initially. B, I'll exercise my joints above and below the cast. C, I can pull out cast padding to scratch inside the cast. And D, I'll apply ice for 10 minutes to control edema for the first 24 hours. Look for the wrong option here, or the wrong statement made by the patient. Reflecting knowledge deficit or reflecting a misunderstanding about the cast gear. You should select letter C this time. I can pull out cast padding to scratch inside the cast. This can lead to skin damage and also infection. What you should do here is to reinforce the teaching about proper methods of relieving the itching, possibly with the use of a cool air from a blow dryer. Now, if you selected letter A, I'll elevate the cast above my heart initially. This is a correct statement. This can reduce swelling and promote circulation. Initially, that's true. If you selected letter B, I'll exercise my joints above and below the cast. This can maintain the flexibility. So that's also a correct statement made by the patient. Letter D, I'll apply ice for 10 minutes to control edema for the first 24 hours. It will reduce the swelling during the first day. So that also reflects understanding. So you're going to select here that option. That is reflecting misunderstanding. That is our option letter C. Pulling out the cast padding to allow them to scratch inside the cast. Number 13. After educating a client with a femoral fracture about the purpose of skeletal traction, which response by the client would suggest that more teaching is required? A, to help realign the broken bones. B, to provide a constant pull over time. C, to apply 25 pounds or 11.3 kilograms of force. D, to apply traction using a boot. We're talking about skeletal traction, not skin traction. You're going to identify that option that will require more teaching. The correct answer here is letter D, to apply traction using a boot. Please remember that whenever there is a skeletal traction, the use of a boot is not involved. Okay? There's no boot in a skeletal traction. What it does, it is going to rely on the use of the pins or wires that are directly inserted into the bone, and this is to apply the force and realign the fracture. Now, if you selected letter A, to help realign the broken bones, yes, that is true. That is the primary reason why skeletal tractions are used. If you selected letter B, it provides a constant pull over time. That is also a correct statement, so we're not going to select that. If you select letter C, to apply 25 pounds or 11.3 kilograms of force, this is the typical weight that should be applied in a skeletal traction. Again, letter D is the correct answer here because it does not require the use of a boot. This is something that you will expect in a skin traction. Okay. Now, what's involved in a skeletal traction, especially if there is a femoral fracture? Well, this could also use what we call the Steinman's pin, or it could be the Kirschner's wire, and these are going to be inserted through the distal femur below the fracture or the proximal tibia. And the weights are going to be applied through a pulley system to provide a constant traction, so to align the fragmented bones. Now, another involved device that will be used in a skeletal traction is the balance suspension. And this is going to be used together with the skeletal traction, which will support the leg in a sling while the weights maintain in a proper alignment of the femur. So it will allow some movement while keeping the leg aligned and in traction. Let's have number 14. The nurse is creating a care plan for a client with a femoral fracture in balanced suspension traction. Which intervention is likely, or least likely rather, which intervention is least likely to be part of the care plan? Is it A, using a fracture pan, B, checking for redness on the skin over the ischial tuberosity, or C, raising the head of the bed no more than 25 degrees, and D, providing a complete bed bath? Our case here is of a patient that has a femoral fracture and has a balance suspension traction. So you're gonna select that action that is least likely to be implemented. And what would be that option? The correct answer here is letter D. There you go. Well, a typical complete bed bath is not to be done, especially in this type of traction, because this can cause excessive movement and also repositioning of the patient, which can disturb the alignment and also the effectiveness of the traction. So complete bed bath is not recommended for this case. Again, this can compromise the treatment of the femoral fracture. It can alter the balance needed for the bone healing. So what's to be done here instead is to encourage the patient to participate in self-care activities, maybe such as moving with the help of a trapeze bar. Now, if you selected letter A using a fracture pan, this will allow the patient to use the toilet, in bed, that's considered a toilet around this time, without disrupting the traction. If you selected letter B, checking for redness on the skin over the ischial tuberosity, this can help prevent pressure ulcers. And if you selected letter C, raising the head of the bed no more than 25 degrees, this can help prevent the client from sliding down without disturbing the traction. Okay, let's have our number 15. A client in balance suspension traction is being transported to surgery for a closed reduction and internal fixation of a femur fracture. What should the nurse do during the transfer to the operating room? A. Move the client to a stretcher with a manually maintained traction. B. Call the surgeon to request permission to temporarily remove the traction. C. Transport the client on the bed while ensuring extra help is available to stabilize the traction. And letter D, remove the traction and transfer the client to a stretcher. Carefully select your answer here. Your option for this item should be letter C. You as a nurse should transport this patient on bed with additional assistance in order to maintain the traction, making sure that the femur stays aligned, and this is going to prevent more injury before the surgery. If you selected letter A, manual suspension of traction is not safe for transport. If you selected letter B, there's no need to request the surgeon to approve for traction during transport. What you should do here is to maintain traction. That is your nursing responsibility. If you selected letter D, remove the traction and transfer the client to a stretcher, this can cause complications and it's not advisable without a specific order. Can't remove the traction this time. So the best answer here is to do letter C. Let's have our number 16. A client who had internal fixation and pin insertion for an extracapsular hip fracture has returned to the unit with a drainage tube at the incision site. The client's spouse asks why the tube is in place. Which response by the nurse is most appropriate? A. The tube will prevent fluid buildup at the incision. Or B, it helps detect early signs of infection. Or C, this reduces the need for wound irrigation. And D, the tube is used to deliver antibiotics to the wound. So there is that drainage tube at the incision site. Why there is such drainage tube in place? Your best response to the spouse should be letter A. The primary function of the drainage tube is to prevent the accumulation of the fluid at the wound site, so to reduce the risk of abscess formation, and it also promotes the healing by eliminating the dead space. Now, if you selected letter B, it helps detect early signs of infection, although the drainage tube may show signs of infection, but that is not the main purpose of why the drainage tube has been placed. If you selected letter C, this reduces the need for wound irrigation. Well, the drainage tube doesn't really eliminate the need for wound irrigation if necessary. So that is a caveat here. If you selected letter D, the tube is used to deliver antibiotics to the wound. That's not going to be used as a means to deliver the antibiotics. No, we don't do that kind of procedure. This is incorrect. Now, your goal here is to eliminate the other options that will reflect like, let's say, reasonings that are not really reflective of the function of the drainage tube. So your task here is to focus on the prevention of fluid accumulation to enhance wound healing. That is the main purpose why the drainage tube is in place, to remove excess fluid. And this is to prevent increased dead space. Number 17. Again, the correct answer is letter A. Let's proceed. A client with an extracapsular hip fracture is scheduled for surgical internal fixation with pin insertion. During pre-op teaching, what explanation should the nurse give for why this procedure is preferred? A, it reduces the risk of hemorrhage. B, the client can regain mobility more quickly. C, there's a decreased chance of infection. And D, the risk of neurovascular impairment is lowered. So what would be that explanation? Pin insertion while you're doing the pre-op teaching. The correct answer here is letter B. The client can regain mobility more quickly, because the purpose of putting the internal fixator, it is going to stabilize the fracture. It will allow the patient for much quicker mobilization, which is essential in preventing complications associated with immobility. Now, if you selected letter A, it reduces the risk of hemorrhage. Well, the procedure itself does not prevent hemorrhage, which is actually a risk in bone surgeries. If you selected letter C, this is also incorrect. This surgery does not reduce the risk of infection. There is a risk of infection. Remember that there is a placement of that fixator. It can allow microorganisms to enter. So this is not true. And letter D, the risk of neurovascular impairment is lowered. There is no guarantee for letter D. Okay? Complications, especially neurovascular complications with this type of procedure, is not reduced. So this is a wrong statement. So your task here in answering this question is to eliminate those options that incorrectly focus on preventing complications unrelated to the patient's mobility. Now let's have our number 18. To assess the effectiveness of box traction in a client with an intercapsular fracture of the femur, what should the nurse evaluate? A, monitor the client for hip dislocation. B, check for contractures in the hip. C, assess the client's peripheral pulses. And D, ask the client about hip pain. Again, we're talking about box traction, which is a type of a skin traction. The correct answer here is to do letter D, ask the client about the hip pain. Again, the purpose of the box traction is to immobilize the leg, and it will alleviate painful muscle spasm. So if you are asking the patient about their hip pain, this is the best way to assess whether their traction is effective. If you selected letter A, the box traction doesn't prevent or address dislocation. If you selected letter B, contractures are not really a typical concern in the short term with this type of traction. And if you selected letter C, assess the client's peripheral pulses. This is important, but it does not measure the effectiveness of box traction. Again, recall the main purpose of the box traction, which is to reduce pain by stabilizing the fracture. All right. And we have our last item of the day. A client who has undergone open reduction and internal fixation for a hip fracture expresses readiness to get out of bed. What should the nurse do first? A, administer pain medication to reduce discomfort. B, ensure the patient's weight-bearing restrictions are known. C, arrange for a mechanical lift to assist in the transfer. And D, assign the transfer task to unlicensed assistive personnel. Look at the question stem. What should the nurse do first? And the patient expressed readiness to get out of bed. Now, if you selected letter A, administer pain medication to reduce discomfort, we know that this is very important. You should administer pain medication. But before you're going to proceed in doing this, you need to do letter B. You got to know the weight-bearing status. So you got to look for that prescription in the chart. Make sure that the medical provider has put that in place. Okay? And this is to ensure that there is safe mobilization after the surgery. Again, you should know the weight-bearing status as ordered to promote safety. You just don't let the patient be impulsive in getting out of bed without identifying first the prescription. Now, if you selected letter C, arrange for a mechanical lift to assist in transfer, this is not typically required in this case scenario. And if you selected letter D, assign the transfer task to unlicensed assistive personnel, you as the registered nurse here should supervise the initial transfer. This involves assessment. So this is something that you cannot delegate to a UAP. Initial transfer. Take note of that. And so again, our priority here is to promote safety when you are mobilizing a patient post-surgery. And again, take note about the weight-bearing status. Make sure that this is in place in the medical record in order for you to maintain safe movement of your patient. So that's the end of our Q&A today. I hope that you are learning from this session, and we do appreciate your time with us. And again, don't forget to hit the like button and also to subscribe this channel and share this to your friends if you find this session helpful. And don't forget to sign up for NCLEX review at stancoast.nclexcoaching.com. And we'll see you in the next one. Thank you so much.